Good evening, and thank you for joining us on this Monday night. We're going to begin with breaking news involving 2 coronavirus vaccines, just as the Delta variant of the virus is rapidly spreading among people who haven't been vaccinated. Now, as we come on the air, the FDA has issued a new warning label for Johnson & Johnson's single-dose shot, an unusual move that comes after the agency linked the vaccine to a rare syndrome affecting the nervous system. Now, the disorder, called the Guillain-Barré, can start with tingling sensations in the arms and legs, and in some cases lead to paralysis. Still, scientists say there are only a few cases connected to the vaccine and that the J&J shot is safe and effective. Now, the new warning is being added just as COVID infections are spiking, up by 30% nationwide in just a week. Experts warn this summer surge is being fueled by the highly contagious Delta variant, calling it the most dangerous and contagious strain of the virus so far. Now, the spread of the variant is one reason Pfizer says it now wants approval to give booster shots of its 2-dose vaccine after some studies showed immunity began to fade after about 6 months. CBS's Nikki Battiste is going to lead off our coverage tonight from New York City. Good evening, Nikki.
Nora, good evening. It's younger adults with COVID who are filling up hospital beds at a staggering pace. Only half of those ages 18 to 24 have received 1 dose. And now those new warnings tonight about the Johnson & Johnson vaccine. The FDA tonight is adding a new warning to Johnson & Johnson's 1-dose COVID vaccine after about 100 people who got the shot developed a rare but serious autoimmune disorder that attacks the nerves called Guillain-Barré. The CDC says the cases have mostly been seen in men 50 and over, about 2 weeks after receiving the shot. So far, there have been nearly 13 million J&J doses administered nationwide. Given that, health officials say the benefits of the vaccine far outweigh the small risk.
We've seen this with one of the influenza vaccines a couple of decades ago. The good news is it looks like it's extremely rare.
This comes as Pfizer met this afternoon with top White House officials to discuss possibly offering a 3rd shot of its vaccine to some high-risk Americans who have already been immunized. The company says its internal data shows antibody levels jump 5 to 10-fold after that booster. For now, the government says booster shots are not necessary.
There is a recommendation on providing boosters. It's going to be for a select portion of the population, perhaps people who are older, who are more than 7 or 8 months from completing their original vaccination. It's not going to be a general recommendation for the entire public.
Meanwhile, the highly contagious Delta variant continues to spread amid warnings that parts of the U.S. could soon become breeding grounds for other new and more dangerous variants that could evade vaccines.
If the Delta variant is allowed to accelerate, sure, I think we could see additional variants emerge.
Since just last week, average daily cases in the U.S. are up 30%, more than 1/3 of them in 5 hotspots. And health experts are blaming the unvaccinated for the spike.
It sounds like essentially we're going backwards. Is that the case?
We are. We had this beat. And I said, if we can fully vaccinate the American people, we can resume pre-pandemic life. And now we've squandered that opportunity partially, at least in parts of the countries.
In a statement, J&J says it's in discussions with the FDA and other regulators. The company adds that cases of Guillain-Barré Syndrome are rare, but that J&J supports raising awareness about all possible side effects. Nora?
Nikki Battiste, thank you.